Sure. My name is Mark Hurd and I was diagnosed with colorectal cancer in September 2016. It was quite a surprise to me. I didn't feel particularly poorly. Went to the toilet, found blood. My doctor then put me in touch with the hospital to have a colonoscopy. And when the colonoscopy was performed, they found a 7 centimetre tumour, very low down. So it was quite a surprise, as you can imagine, being, I was 43 at the time, 45 now. And, obviously your world turns upside down and, the devastation. But then I think the mind is such a strong part of your being. The fact that within about a week's time, I think my mind had conditioned itself into, okay, you've got cancer. Now, what we're going to do to try and beat the cancer. So I then went straight on to a concoction of radiotherapy and chemotherapy. And unfortunately, they couldn't do a standard procedure, which would have been what they call, I think, a cut and shut. Because my tumour was so low lying, they couldn't do that. So after the radiotherapy and chemotherapy I received as soon as I was diagnosed, that was quite positive. The radiotherapy did shrink the tumour, however it did shrink everything else around the tumour, so it became very hard for me to go to the toilet, so much so that we decided in early March of 17 to go into hospital and have a full bowel resection where they take part of my bowel away, and obviously I'm left with a stoma bag now. Something that I didn't particularly want to happen, being at the time I was 44 years old. But obviously your mind very much conditions itself and accepts things, and what's the alternative? You hopefully recover with a stoma bag on, or the other alternative isn't the one which anybody would wish for themselves. So so I had the stoma bag on. I then had 4 other chemotherapy treatments for colorectal cancer, and unfortunately they weren't successful. So I didn't respond to those, and that kind of brought me up to February 2018, where my oncologist sat me down and told me that unfortunately it was a terminal diagnosis that I had, and there was no other treatments which I could be offered in the UK for the colorectal cancer, because whilst we had removed the primary tumour, unfortunately it had spread and metastasised in my lungs, 7 small pieces in my lungs, and 2 pieces in my liver as well. So that was when I had my terminal diagnosis in February, and at the same time my wife had also come across Hallwang clinic here in Germany, and after speaking with the medical team, we decided that they said that they were very positive and that they could work with me to try and obviously beat my cancer. So no time was spared. I headed straight over and arrived here at Hallwang on, I think it was the very end of February, and I started my treatment here the 1st of March. And I've found the whole experience fantastic, travelling over to Germany, and the setup here in Hallwang clinic I find exceptional. The oncology doctors seem to be the very forefront of their game, their profession, with a great deal of knowledge, and can offer me treatments over here which I can't currently get over in the UK. And the reason why she was so interested in Hallwang clinic is because it seemed to be very cutting edge and at the forefront of cancer treatment, and she'd seen lots of success stories on the internet. She'd seen I think there was a lady who'd been here who was then on This Morning television programme in the UK, and she was explaining how she'd been given a terminal diagnosis and now she's fully fit and well. So there was quite a lot of different situations that she'd looked on the internet and found that it was a real positive story. And in fact, when I eventually came over here, the amount of people who you come across who are also receiving treatment, and they've been coming here since 2014. You know, there was an elderly lady here, and I think she may have had, I think it was a brain tumour, and she'd been coming over here and receiving treatment since 2014. But you do find people, not just, there is a lot of English coming over here, but you do find every nationality from, you know, from all different areas of the world. I've met quite a few people from Australia, Tasmania, America. You know, there's people are travelling because obviously of the strength of what can be offered here, I would say. Feedback from the clinic was that my tumours would respond favourably to these breast cancer drugs, because I have something called HER2 positive expression. So yeah, so that's what my treatment plan at the moment has been: immunotherapy and 2 chemotherapies, which I actually receive over in the UK now, unfortunately, because they're not. England seems to be quite governed in what you can and can't do, and because I have had indications that the 2 breast cancer drugs would be successful for me, but I have colorectal cancer, not breast cancer, so therefore I can't receive those on the NHS or from a private medical insurance. So I do pay for those in the UK, but the very much the upside is from the immunotherapy and the mixture of chemotherapy drugs. I've had very, very positive results in my last CT scans. And we're now discovering and exploring some other treatments, which is what I'm over here for at the moment. We also have found out from sending tumours over here in Germany that my tumour wall has something called survivin, which is a protein, and I have between 10 and 20% coverage. So we're now starting a treatment to try and kill off the protein, which will then hopefully allow the chemotherapy drugs to work more effectively. So we're really, I suppose, going for it to try and, you know, really get rid of the stuff in my lungs. I'm also, we've been looking at the 2 tumours in my liver, and we're going for further procedures and treatment for my liver to try and kill off the 2 in my liver. First of all, what we're doing is taste treatment. So injecting a high cocktail of chemotherapy drugs directly into the tumours, to try and kill those off, or certainly shrink them down. And then another procedure which is called IRE, which is electric therapy, to try and blast holes in the tumours within my liver to try and kill those off as well. So that's where we're at the moment. And the concoction of the immunotherapy and the 2 breast cancer drugs, I've had my first results of the CT scan, and I've had a really positive outcome. The 9 metastasized tumours in my lungs have reduced by up to 50%. So that's a really, really positive outlook, you know. So myself and my family were all over the moon, very happy with how the treatment's going. When I knew I was going to be travelling over to Germany and Hallwang, Germany's not a place which I'd been to too many times before. I came over briefly for the World Cup, when the World Cup was on. However, I didn't spend a great deal of time here and travelled in Germany at all. So I was slightly apprehensive about coming to a new place, not really knowing anybody or really where I was going to. However, all my fears were allayed as soon as I arrived here. My wife, we have 3 wonderful children, so my wife didn't travel with me because she obviously looks after the children. So one of my good friends travelled out with me. First of all, I was in quite a poorly state of health when I arrived at the beginning of March for my treatment. However, there's so many flights from the UK and so many ways to get here. I particularly fly from Newcastle to Amsterdam, and then a very quick connection flight Amsterdam direct to Stuttgart. And the clinic here, more often than not, have sent a driver to pick me up to then bring me straight down to the clinic. It's roughly just over an hour's drive from Stuttgart Airport, an hour and 10 minutes I think it is. and you arrive to Donstetten, which Hallwang is the clinic is in Hallwang, a very small village. It's quite remote. It's lovely, quiet, peaceful location. But there's so much happening around where you can, if you have days off from treatment, you can travel around and sightsee quite a lot because we're in the Black Forest here, and there's just so much to see and do. So yeah, when I first came over, I was slightly apprehensive with the travelling, and now manage it so I fly and arrive late one night. If I'm coming for a 2-day treatment, I'll arrive quite late one night, stay the first night, and then the next morning I get up, have my bloods taken, the blood results come back within a few hours, then I start treatment straight away on the first day, and stay overnight the second evening, and the next day have a second day treatment, and then after my second day treatment I just travel straight home. So I'm only away from home for 2 nights for a 2-day treatment plan here. But this time I've been over for 5 days because I've started a new treatment plan, and as you can see I feel a lot more fit and healthy now. So I decided if I was coming over for 5 days and I had a spare afternoon here and there, it would be quite good to go and travel around and see the sights of the Black Forest, and that's exactly what I did. I just hired a car from the airport, so simple and easy. Came down, I was here an hour and 10 minutes later, and I have done some sightseeing, been to some wonderful places, been to Treeberg, had a look at the waterfalls there. So yeah, that was very good. But I must say the facilities and the services here at the clinic itself are second to none. It's such a it might sound strange this, but it's quite a happy, upbeat atmosphere where obviously everybody has cancer and everybody's very concerned about how poorly they are. There's a very good rapport between the staff and the patients, and certainly between all of the other patients as well. You can talk to other people about your situation and they share what their problems and situation is. So it's a very good community, let's say, within the clinic, and you're reassured by how the hygiene side of the facilities here and your treatment. You really do feel that everybody is so knowledgeable and so on top of the game, their profession here.